All right, let's get back to the questions for the mayor. Mayor, how long is the stay-at-home order for the county? Are you working closely with the county on this, or is it primarily just city?
We have been working very closely with the county from the very beginning of the crisis. We're in daily communication. The formal county order, I believe, goes through the first week of April, but I think the anticipation should be for everyone that this is going to go several weeks beyond. And we're all adjusting, of course, to what we call the new normal here. And we are at the city doing everything we can to try to mitigate the impacts on small businesses, on child care providers, obviously the food delivery system, especially for people who are shut in. We're trying to plug holes in every way that we can. And really, my job more than anything, Walt, these days, I think, is to be the convener in chief. We are trying to bring every stakeholder in the community together who has an impact on any of these issue areas. And I'm really, grateful for the way people are responding, working endless hours and dropping all pretense of this is my territory instead of yours. People are just really stepping up, and that includes the governments as well. We're working better with the county than we ever have before.
Well, that's good to hear. I think you've been placed in that position many times where you're the official mediator and you're a good listener for both sides, and sometimes that really jams you in the middle. But I think we need somebody like that certainly these days. All right, next question. I'll get off my soapbox. What's the city doing to help the homeless? We're getting a lot of questions about their health and how is this going to impact them?
Well, as you know, over the last number of months, as I'm chair of the governor's statewide task force on homelessness, and I've called for a legally enforceable mandate for every level of government to bring people indoors. We now have a chance in real time to actually accomplish much of that because of the coronavirus. Here in the city, again, we are working in a task force with the county. We've already identified several hundred hotel rooms where we can first place people who are in our existing shelter system who are either of that fragile population because of age or medical condition or symptomatic, and put them in the hotel rooms, and then do the same triage with those who weren't sheltered and on the street. Our goal here, and we're working on this in real time, is to take the hundreds of hotel beds that we've now identified and begin navigating people into those beds and translate that into thousands, because the homeless themselves are not only the most vulnerable every day, they also are more likely to be carriers of this virus because of their fragile to begin with.
Yeah.
So if we can a little bit more help in terms of emergency assistance outside of the traditional homeless provider system, we can navigate a couple thousand people into the bed that we are trying to raise up this week.
Yeah. Okay, Mr. Mayor, we thank you
goal.
for your time. We're sorry about the audio connection there. It's just everything is sort of patched together, but we do thank you for joining us today, Mr. Mayor. Good luck, and we will visit again soon, hopefully.